Sally. Diana? No, she's not here yet. Have you tried her office? Her bleeper? The coffin in Transylvanian earth in the cellar? Yeah, I will. All right. Michael, have you seen Diana?
No, that new spray must have worked. They take it back to the nest.
It's the second time they called her from upstairs.
Who was it?
First time the general manager's secretary, the second time the medical manager's.
Must have exceeded our sellotape allowance again.
Test results in.
Oh, Beth, can you do me a big favour?
All right.
Did I hear test results in?
I haven't touched them.
Good.
Show him, Beth, all fresh and untampered with.
I don't know why I let you involve me in this.
Because you're unimpeachable. Dr. Brooke has to get out his wallet first.
Yes, to fill it up.
And now, the results, if you please.
Bed 1. Confirmed hiatus hernia. Bed 2. Urine acidification test, pH level raised.
Above or below 4?
Above.
Oh, lucky.
Bed 5. Liver biopsy. No sign of cirrhosis.
Oh, I'm on a winning streak here. I can feel it.
Bed 6. Sputum analysis. Small traces of pneumococcal antigen.
Yes! What do you mean? I had that each way. You can't have each way on pneumonia.
What if the antigen was a result of a previous infection?
With pneumonia, come on, pay up.
I want a steward's inquiry.
Oh, come on, Phil.
What's going on?
Hi, Kate. Bye, Kate.
What was all that about?
Oh, nothing.
Well, got all your things for the weekend?
Yes, just have to pick up a few essentials.
I brought you the hotel's brochure to whet your appetite.
The Cotswold St. Francis Hotel. Relax amid 15 acres of abundant rhododendrons in the oak-panelled cells of a former Franciscan priory dating back to the 14th century.
Doesn't it sound beautiful?
Every room has priceless medieval wall hangings, a Corby trouser press, and complimentary potpourri.
And guess what? There's a croquet lawn.
I thought there might be. And tell me, is there a restaurant in the old chapel called Vespers where you sit on the original hard-wooden pews?
Yes.
Oh, joy unbounded.
6 months ago, I never would have thought we'd be doing this. But I have to admit, you've changed, matured. You're really romantic at heart, aren't you?
Yes. Yes, I am.
The machine in the gents was empty. Do you want me to slip out the boot?
No, I'll pick up a toothbrush on the way there. Thank you, Sean.
Oh, and here's your copy of the reservation invoice in case you get there before me.
Well, I thought we'd both go together on the bike.
Yeah, so we could tie my leg to a rope and drag me behind a pickup truck. That would be another good idea. Ah, there we are. 2 rooms, single occupancy. Oh, and I did specifically request the wing with a view of the cloisters.
2 rooms.
If there's any problem, just wait until I get there and I'll back it out with them.
2 rooms.
Oh, and try and get there by 7:30, and we can sit mead in the old graveyard while they milk the goats. Well, I'm due at my clinic. See you.
2 rooms.
What did you expect?
Yeah, I'll give you 100 to 1. It'll be 1 room by Saturday night.
Oh, it'd be a crime to take all your money.
Once we're there, a few meads, moonlight glinting on the abundant rhododendrons, bang.
You're dead?
I've done everything right. Played by her rules. I even let her choose this god-awful place. It's got to be cast iron. It's got to be.
Wasn't the Titanic cast iron? Hello? No, she still is... Oh, hang on a minute. Morning, Diana.
Oh, is it still morning? I've just waited several hours at a filthy hole in a wall while a wizened hag in a pinny operated an electric toaster as if it were the Space Shuttle Challenger. God knows what we pay these people for.
Oh, we don't pay them, Diana. They're the friends of the hospital.
Well, we should sack them and get ourselves some quicker friends.
The general manager's secretary for you.
Yes? I'll put him on. Mr. Pickles. Hello. What? When? I'll be right out, Mr. Pickles. I want you to stand by to contact every key member of the nursing and medical team for an immediate meeting in the conference room. No exceptions.
What if there's an emergency?
This is an emergency, and not a word to anybody until I phone you.
Good morning, Mrs. Warwick.
Oh, I'm so glad to see you, Doctor. I've been so worried.
Oh, well, let's see how you are today. Blood pressure 120/80, pulse rate 82, temperature down to 98.9. Oh, hell! Hellfire and damnation.
What's the matter, Doctor?
I've just lost a £5. You're all right, though. Nothing for you to worry about. Michael, Can I owe you Mrs. Warwick's accumulator?
You know the rules, Phil.
I'll have to cash a cheque.
I just can't understand it.
What?
Separate rooms. I mean, for the last 2 months, I have put myself through hell on earth. I haven't looked at another nurse. I've had to constantly repress my urges. My sex life has been like...
Like mine.
Exactly. Pathetic wreck of unfulfilled nervous energy. I'm like a coiled spring. Every hormone in my body is screaming, release me. Please, give me some relief, for God's sake.
I'll have to go.
I mean, what does she want? How can I convince her?
Dr. Jimson, Dr. Russell wants to see you.
Ah, there you are. This won't take a moment of your time.
Yes?
Only there's something I'm not quite sure about. I need your help to be certain.
Would this be better standing up, Doctor?
If you wouldn't mind, Miss Carling. This is Dr. Jimson.
Hello.
I thought it might be a good idea if you showed them to him.
Oh, of course. What do you think?
Miss Carling is a professional model. And obviously her figure is very important to her.
Yes, I can see that.
I really want to know what you think of my breasts.
She had implants a couple of years ago. There's no sign of leakage, but she's worried.
I just don't think that they feel quite right. Well, Doctor, what do you think? Do you think they feel all right?
Yes. Yes, they feel, all right.
Well, there's no problem with saline implants normally. All right, Doctor, you can come out now.
Out.
Yes?
Right.
Did I drop my necklace?
Yes, here it is. Sorry.
Good. Well, if there's any trouble, come back. We'll leave you to get dressed.
I suppose that counts as amusing in your warped mind.
Sorry, Michael, I had to be sure you're really focused on us now.
What are you going to put me through next, eh? Are you going to get these two to lick honey off of my naked body?
I'm sorry. Michael.
I mean, I really don't know why you're bothering, just so I can spend my nights alone in my converted monk's trousers with complimentary tapestry press.
Adjoining rooms, obviously.
Because if... Adjoining?
Yes, they have connecting doors, obviously.
Oh!
Oh, I've been really impressed with how you've made the effort recently. No more childish pranks, no more adolescent displays. I'm beginning to quite like you again.
Are you?
Yes.
Michael, here's the £5 I owe you. But if her blood pressure goes up again, all bets are off.
Hell.
What's this?
It's a sweepstake. Michael's running a book on the ward patients, didn't you know?
A book on our ward patients.
He's been doing it for ages.
Yeah, it's just a bit of fun.
I might have known you'd never change. Well, as far as I am concerned... What's that? Fire.
Your guess is as good as mine.
We've all got to go to the conference room straight away for briefing.
Oh, Holy Mary. Is it a disaster? I've never had a disaster.
Did anyone check the news? What is it?
I can't see.
I can see them.
How many?
3, 4. They're stopping out front by the courtyard.
Can you see what they're bringing out?
No, hang on. Wait, they're going round to the back doors. They're bringing out...
What?
a tree. And something else. Some rolled up things. I don't know.
Turf. They're bringing out turf. And some roses in pots.
Geraniums.
And they're unrolling the turf on the courtyard.
Giving a sort of patio garden effect.
Good morning, good morning. We'll dispense with the niceties today, if you don't mind, and get straight on with the briefing.
What's going on?
I've just come down from the general manager, and he has confirmed that at 10 o'clock we'll be having a visitor.
Who is it? Percy Thrower?
I'm sure you'll all be very excited to hear that it's none other than Virginia Bottomley. Virginia Bottomley. I know. I could hardly believe it myself. Virginia Bottomley is coming to our hospital.
Well, she's got nerve, I'll give her that.
What do you mean?
Diana, she's wrecking the health service.
She is the architect of the Trust Hospital scheme. She's coming here to see the progress of her reforms, to witness the unvarnished truth.
Is that why we're turning the front of the hospital into Kew Gardens?
Well, she can't see it how it usually is. It's much too depressing. Now, I have the itinerary here. I'll just run through it briefly. She's arriving at 10 to be met at the entrance by the management team. Then she'll come inside and shake hands with some horribly sick children.
What children, Diana? We've closed paediatrics.
Yes, well, we're borrowing some. Preferably in wheelchairs so they keep still. Then she's having coffee with the general manager, and then she's expressed an interest in seeing one of our wards. Well, naturally, our first thought was to show her the new wing.
But we can't afford to open it.
Exactly. So, after much deliberation and a personal plea from me, she'll be coming up here past geriatrics. We'll be screening off the very old and through here to general and surgical B.
She's coming to our ward.
Yes.
Well, this could be just what we've been waiting for.
What?
You mean we get to talk to her?
Oh, I'm no good at talking to important people. When I was confirmed, the Monsignor had these buck teeth, and I looked up at him and said, "How tickled I am!" That just came into my head.
That's really not the point, Phil.
Obviously, Mrs. Bottomley will only have time to actually speak to one member on the team.
And who will that be, as if I didn't know?
Well, naturally, the honour will fall upon our most senior member, and I'm sure Dr. Regis will live up to expectations.
Which is more than his patients do.
Where is he, by the way? I did specifically require that everybody be present.
Sorry, Diana, nobody's seen him since he left last night.
Maybe he took some work home. Are there any knives missing?
Well, I have a lot of things to put into operation, so good luck, everyone. And let's show Mrs. Bottomley our very best face.
Go straight over and have plastic surgery, then.
I might have known this whole thing would be a whitewash. No wonder she always thinks things are going swimmingly if all she ever sees is happy time at Euro Doctor Land.
We'll have to tell her.
Well, she's only going to talk to Rex.
Want to bet?
It's all arranged.
How much?
I can't believe my ears. We are talking about the state of the entire health service and you're reducing it to the ITV7.
Oh, they don't have that anymore.
Shut up, Phil. Is there anything serious enough in this world that you wouldn't degrade it to some sordid lottery?
I'm quite serious.
So am I.
So how much do you bet?
What?
How much do you bet that I can speak to her?
I give up.
No, come on. What do you bet?
All right. I bet if you lose, not only is the weekend off, but we'll never get to bet on anything again.
And if you lose, I get to choose what you do.
Such as what? Oh, no, you don't. I can't believe you sometimes.
Not only is it on, but with one double room.
You realise what you're saying?
I knew it. I knew you wouldn't have the bottle.
The what?
The bottle, the nerve to put your money where your mouth is.
I'd better be going.
No, I want you to hear this, Phil. If Dr. Jimson has a bottle of his own...
It's just bottle, Kate, not a bottle.
Having silly thoughts, are we?
All right. I'll make it easier for you. I bet not only do I get to talk to her, but I can get her to kiss me. Right.
Phil, you're a witness to this. If you can't get our Minister of Health to kiss you, you'll give up betting forever.
And if I can, it's one double room. Agreed. This is going to be a walkover.
It certainly is.
What are you doing?
Sorry, I've been asleep. Oh, this floor is as hard as a block of wood.
Oh, I'm so sorry. I've never opened a DOS house before. Next time I'll consult sundry down and outs about floor quality.
Oh, Beelzebub, that's the worst night I've ever spent in my life.
Oh, is it? You should try a spiffing night out in a car outside the all-night Burgerama on the A11. I'm sure you would enjoy waking up to the smell of fried onions and a gang of football hooligans leering in at the window and chanting, "Ooh, ah, Cantona, stick a burger in her bra."
Pauline's thrown me out.
What?
She's thrown me out of the house.
Did you tell her about us?
No. She just said she couldn't live with me anymore. She couldn't stand it any longer.
Oh, that couldn't be better, could it? I mean, that's what we've been waiting for, isn't it?
Everything seemed normal when I got home. She was sobbing in the bathroom, as usual. And then, at supper, I happened to remark that her lamb was overdone and she had a sort of screaming fit. Then, when I quite tentatively suggested that she try electroconvulsive therapy, she threw me out of the house. My own house.
Oh, you got a key?
She's changed the locks.
Oh, well, look on the bright side. At least you're free.
Diana, it's in her name. The house, the investments, everything. What am I going to do? What am I going to do?
Well, you could get yourself a shave for a start.
I don't have my razor.
Well, buy one.
I can't use a strange razor. I might cut myself.
Cut yourself? You're a surgeon. You love the sight of blood.
Other people's, not mine. Diana,
What?
do you think you could get me a clean shirt?
Oh, of course, Dr. Regis. And I'll tell Virginia Bottomley when she comes in 45 minutes that nothing is ready, as I've changed my career to a combined men's barber and seamstress. Oh, for heaven's sake, pull yourself together.
Oh, now we get places.
I can't believe you got Kate to agree to that. How are you going to do it?
Well, I can't. It's impossible, obviously.
But you bet Kate.
Well, how am I going to get Virginia Bottomley to kiss me? Get real, Phil.
And why did you say it?
Oh, I don't know. I just panicked. Just saw her with that look.
What look?
That look. Pray you never get it. That basilisk-like gleam in the eye of a woman who's made it her personal crusade to change you, whether you like it or not. You haven't got a chance. Well, not me. Not Michael Jimson. I don't change for anyone.
So what are you going to do?
Rage. Rage hard against the dying of the light.
That's Dylan Thomas. What happened to him?
Stone dead.
Doctor, they're taking me away.
Hey, where are you going?
Diana wants to move to maternity.
Why?
I'm Diana Ewitts. I'm the unit manager for this medical team. And you are?
Trying to get some rest.
I'm just taking down a few personal details of the people that we have in here.
You had that woman carted off.
Yes, she was simply relocated for operational reasons. Now, are you aware that this hospital is one of the new health service trusts?
Yes.
Do you think health service reforms are bringing real benefits to the patient?
Oh, yes, certainly.
Are you aware that Mrs. Virginia Bottomley is responsible for these benefits?
Yes.
Would you be prepared to speak to Mrs. Bottomley, given the chance, and endorse her reforms?
Oh, yes, I'd love to.
Oh, excellent.
Now, I'd like to ask you a couple of questions.
Oh?
Do you know what I've got connected to my private parts?
No.
A catheter. Do you know what function the catheter performs on my body?
No.
I'll give you a clue. It takes from me what I've been taking from you about Virginia Twadding Bottomley.
I am rather pressed for time.
2 years I waited for this bladder operation, wet in the bed, not able to drink.
Thank you for participating.
Too many
in our
chiefs, not enough
our
Indians this
survey.
place.
Over here,
I'll
please.
tell her what I think of her health service.
Thank you very much.
You see if I don't.
Yes, get rid of him.
But I've still got to bring back Mrs. Warwick.
Bring her back. Why?
Dr. Jimson said.
Dr. Jimson, I think there's been a slight misunderstanding. I had Mrs. Warwick transferred.
To the maternity ward.
Yes, is there a problem?
She's having a hysterectomy, Diana.
Where do you want this one?
Where am I going?
Just a minute, Sean. Mr. Edmonds is recovering from a bladder operation this morning. He really can't be moved. It's too painful.
Good.
I really can't allow it.
And I cannot allow the possibility of one of our units giving Mrs. Bottomley the wrong impression.
If you're going to banish every patient who might disagree with her, you're going to have an empty ward, Diana.
Nonsense. We have Miss Eastman.
Miss Eastman. We don't have a Miss Eastman.
Yes, we do. I found her in a private room and I had her brought over. Miss Eastman, hello.
Hello.
Would you like to tell Dr. Jimson what you feel about Mrs. Bottomley?
I think she's a saint. She's really made a difference to the way hospitals run. They're so nice now. Not at all dreary or depressing.
She's on intravenous diazepam. Miss Eastman, I'm afraid we're going to have to staple your legs to the floor and shove a rabid wolverine up your nightdress.
Oh, that sounds nice.
Draft of Valium, Diana. She's away with the pixies.
The fact remains we cannot endanger our funding. We can't allow Mrs. Bottomley to face any unpleasantness.
She'll be facing Rex.
Why'd you say that?
What?
think Dr. Regis's personal problems are no concern of anyone's.
I don't follow.
Oh, very well. Take her away and bring back the other one.
What's the matter with her?
Search me.
Ah, Diana, I think we should talk.
I can't. Mrs. Bottomley's coming in 20 minutes.
What do you think you're staring at?
Oh, I'm sorry. I'm just rather anxious. I'm having an operation.
Oh. Well, I'm the senior surgeon.
What's the panic, Kate?
Ah, Phil, thanks for coming.
Where's the patient that needs urgent referral for surgery?
It's me. I need a lobotomy.
What?
Why did I let him talk me into making that bet? Why? Why? Well?
I don't know.
Isn't it obvious? I'll tell you since you asked. He gave me that look.
What look?
That look that says, you're never going to change me. Do you know what that's like for a woman? No, of course you don't. You're not a woman. But you know that.
I'm getting confused.
Oh, I'm sorry, Phil. I shouldn't take it out on you, should I?
No?
No, of course I shouldn't. I don't know. It was all going so well. He'd stopped looking at every young nurse that thrust her breasts into his egg and bacon. We hadn't had an argument for ages. He even liked the hotel I picked for a romantic weekend. God knows why I hated it. And do you know what the very worst part of this is? He's going to win.
Ha!
What?
He can't win.
What do you mean?
How could he get someone he's never met before to kiss him? It's impossible, obviously.
Phil, you are a complete idiot sometimes. Clearly he can do it or he would have made the bet.
I don't think so.
Then I'll have to share a room with him.
He can't win, Kate. He knows that.
What makes you so sure?
He told me. He wants to call the whole thing off.
Does he? Does he really?
So, she'll be entering here, past the art display, which, by the way, is one of our latest enhancements to the environment. We do feel that people deserve to have beautiful things around them at a time of anxiety. Oh, do please go away. You're getting phlegm spots on the Mondrian. And then there's a photo opportunity here as part of the government's campaign against glandular fever. You'll be able to get lots of shots of her with myself and the medical team representative.
What exactly is glandular fever?
Oh, it's just one of the many fevers that we have here.
So how will we show it in the photo?
Sorry?
What will the picture be? Have you got a gland she can hold? The doctor could pass it to her?
Well, I think I probably better get back to you on that one.
Oh, there's the doctor.
Oh, no, he isn't the doctor.
There's the doctor.
Oh, no, he isn't the doctor either.
So where is the doctor that's going to meet Mrs. Bottomley?
Well, if you'll excuse me, I do have a lot of things to attend to, so perhaps you'd like to take some shots of the sick people.
Michael, Kate wants to see you as soon as you can make it.
All right, okay, in a minute, yeah?
I managed to send out for this.
Oh, thank you.
Thanks are not necessary. I didn't obtain it from any sense of personal warmth, but to maintain the good impression of this hospital by the Secretary of State for Health.
Diana, what I said
Please,
earlier...
don't insult me by trying to claim you were momentarily distraught.
I don't think I made my feelings clear.
On the contrary, you made them perfectly clear, for which I thank you. I can now discontinue, without regret, this sad and pathetic twilight life.
Diana, I want you.
Well, we can't always have what we want, can we? I, for example, want a white, clean ceramic hob. But like me, it's just much too expensive.
Sorry, Mr. Regis.
What do you want?
We just had a message from upstairs. Mrs. Bottomley's car is 5 minutes away.
Thank you. We'll talk about this later. Oh, my lipstick. Get that.
Hello? Yes, it is.
Well, how do I look?
That was the switchboard. They've been trying to trace me. Pauline's left a message.
Oh?
She wants me to go home immediately. She says she needs me.
Well, it's a little late for that, isn't it? Isn't it?
No naked women this time?
Can we just stop wasting time on this pointless banter and get to the point?
Sure.
Look, I don't want to damage your pride. For God knows you've got enough of it to carry it around with you in a big string bag.
Thank you.
And so, for the sake of our relationship, I am going to make the first move and say, let's call this ridiculous bet off.
Call it off.
Yes.
Chicken, eh?
Oh, God, why are you doing this? You know you can't win. It's just going to cause bad feeling when you do. And I don't want that. Do you understand?
Yes, I think so. You are chicken.
I am not. I'm trying to preserve your dignity. Shut up! I ought to have known it. You never change.
I don't have to. I'm going to win.
Do you want a bet?
Already have.
All right, since you're so confident, how about raising the stakes?
Oh, yeah.
Oh, yes. If you lose, you will change. Not just on this, but on everything I think you should change for the rest of your life.
And if you lose, you'll accept me as I am and I'll never have to change.
You got a bet.
Right.
I'm sorry to interrupt you, but there's been a slight hitch.
Diana, are you all right?
Perfectly. But a small crisis has begun to emerge. I need someone else from the medical team to be presented to Mrs. Bottomley.
What about Mr. Regis?
Dr. Regis has had to go home. He's had an urgent personal call from his wife.
Or so he thinks. To chicken out now?
I don't think so.
Great idea about the photo, Doc. Didn't realise that glandular fever was sometimes known as the kissing disease. Make a great pic.
Still not too late, you know?
A bet is a bet. There's no getting out of it.
You said it.
And the bet was that you could get the Minister of Health to kiss you.
That's right.
You realise, of course, that Virginia Bottomley is the Secretary of State for Health.
Yes. What?
The Minister of Health is that man in the suit. Editions.
You realise what this is doing to my reputation?
Oh, I wouldn't say that. There's a crowd of young nurses waiting downstairs to see the celebrity.
Is there? Oh. Well, I'd better go down and see them then.
Oh. Did I forget to say what sex they were?